Good morning, everyone. I'd like to publicly thank the Governor and Lieutenant Governor, as well as Secretaries Pizer and Sutters and Commissioner Cook from DPH, and everyone who works for the administration for the incredible hard work and commitment they've demonstrated to keep our kids learning safely in our schools. This new at-home testing program is frankly a game changer, and it wouldn't have happened without the dedication and collaboration of so many. Providing this option for at-home rapid testing will allow school nurses to spend more time identifying symptomatic individuals and focus their efforts on other aspects of COVID-19 management in our schools. Moreover, by providing at-home testing for our students, teachers, and staff who participate in the statewide school testing program, we'll be able to offer more testing every week than under the current Test and Stay program. Remember, the Test and Stay component of our testing program was developed as a strategy to keep unvaccinated kids in school by testing them after they were identified as a close contact. And it has been a great success. We've been able to save nearly 500,000 school days that otherwise would have been lost to quarantine. All of us owe a huge debt of gratitude to the school nurses who took on this massive task to keep our kids learning in classrooms. They spent countless hours, days, and nights and weekends to keep our kids in school. They are the true heroes among us today, and we are so thankful for all their tireless dedication. But at this point in the pandemic, we've also heard from many nurses and school administrators urging us to make changes to our Test and Stay program and the contact tracing associated with it. And both our medical advisors and the DPH say it's time to pivot. Again, Test and Stay was conceived and launched before every school-age kid was eligible for a vaccine. All school-age kids are now eligible for a vaccine, and to the governor's point, we strongly recommend they get it. Moreover, no one had access to at-home rapid antigen tests that we will be sending out shortly, and that changes the calculus. Massachusetts was one of the first states to launch Test and Stay, and the CDC, so many months after our adoption, recently jumped on board as well. But it is now time for us to lead again and change strategies to adapt to the current conditions of this pandemic. We need to pivot from strategies that worked in the fall to policies that are more aligned with how things have changed. Through the governor's commitment to purchase 26 million at-home rapid antigen tests from iHealth and make schools and childcare a priority, we now have an opportunity that wasn't available to us before. This new testing option will allow health personnel to focus directly on symptomatic individuals rather than identifying asymptomatic close contacts. At this point in time, we need to shift our attention and resources to mitigation efforts. Schools that want to keep the testing program they currently have in place will be able to do so, but we recommend they make this switch that will enable them to provide weekly at-home tests. As always, we are committed to using available data to inform our recommendations to schools and districts. This new option will give Massachusetts school districts more flexibility and resources in COVID-19 testing that will have the most immediate impact to keep our schools open. The at-home tests will be shipped directly to school districts for distribution, and are packaged in kits of 2. Students and staff who participate will receive 1 kit every 2 weeks to test at home. If an individual tests positive, they must inform their school and their healthcare provider of the result. Schools will report positive cases to DESE as part of our weekly COVID-19 reporting that is already in place. We continuously look at the data we have related to our schools, as well as what innovations we have available to improve our testing program. Today, we are bringing together both this new testing option for everyone for better results for our kids. Thank you.